started. Welcome to the Health Hub with Dr. T. As you know, I'm Dr. T. And today we have, well, it's Men's Health Month. And so,
Ooh.
no better person to bring on than a man to talk about, to kind of wrap up this month. So, we have Dr. Raymond Mbah here with us today. And we're going to just dive into men's health, just different information. He is not your personal physician. So, any treatment questions he's unable to answer directly, but he is able to guide you in a general direction. Welcome, Dr. Raymond. I call you Dr. Raymond. So welcome, Dr. Raymond Mbah. And you can just go ahead and start with a little introduction, and then we can get right into it.
All right. This is an honor to be here. This is I think when we start talking about having platforms and uh, utilizing your gifts to either give back or make some form of impact, I think uh, Dr. T, you're doing this just amazing, and I'm glad to have gotten this invite, and I think this is going to be interesting. This is going to be lovely. But
Yes.
Dr. T, me and Dr. T, we go way back. I'll start there. Uh, Four flats on a Cadillac. That's how far back we go. Most of you,
Right.
most of you on this live, you are aware. All the way as far back as middle school, just about
Right.
middle
Yeah.
school.
Middle school.
Yeah,
Middle
and I want
school.
and I know I'm not giving off an age because middle school was like
No,
5 years
no,
ago.
we don't do
You
that.
know, we
Mm-mm,
don't do that.
we
But
don't.
as she did say, I've been working on this title, and they finally bestowed me with this title last year. Officially, I'm Dr. Mbah. Uh, I am a adult internal medicine, as well as a pediatric resident, and it's quite surreal because today actually makes me uh, 1 year in the game.
Wow,
Yeah, today
congratulations.
actually makes me 1 year in the game. So my intern year is over with my program, and uh, I think what a lot of people are not aware of when we start talking about um, like med school and all the different milestones and achievements, you go through certain things. This was a big year because technically I was still an intern, right?
Mm,
So when you watch the show The Resident or whatever it is you may partake in, your favorite, when you partake in your favorite hospital show or whatnot, yeah, most of the first year you're an intern, and then from your second year forward, you become a resident. So officially, I'm a resident, and
yay.
yeah, I've been in healthcare since 2009. I have worked well over a decade as a respiratory therapist prior to returning back to school to pursue a lifelong dream. So, uh, if you put everything together, I've probably been doing this going on 20 years. Not
Wow.
not all in the capacity as a physician, but in different aspects of healthcare. So
Mhm.
I'm absolutely thrilled to be here. Let's get into it. What is our topic? What
Yes, let us
what?
get into it. Let's talk
Yeah.
about men's health. Let me start by here. Let me start here. So obviously I have my connections or my network. Let me say that. I have
Mm-hmm.
my network of people that I have in the back of my mind that I want to come on and talk about certain topics. But however, I was doing a little research before this. I was saying, okay, if I were a man and I wanted to look for either a physician or someone that could lead me towards someone in the healthcare entity to help me, I found some difficulties with that. I
Okay.
found that it's not a lot of the physicians that I saw were women. And so, if I were looking from the lens of a man looking for a man to, like a man physician or urologist, it was quite difficult. And so it made me think about, is that something that holds men back from, getting checked, getting their physicals? If they had a problem, is it hard for them to get a hold of another male to be able to air out their problems? But I found it to be quite difficult to get a male physician. I don't know if that's real. It was just me, but
No,
it was hard.
and I think what you're saying holds a lot of weight. Uh, I remember the first time I decided to pick a primary care physician, right? I think I was in possibly mid 20s when I decided to pick a primary care physician. And that is terrible, right? To think that,
Mhm.
I had gone, 20 plus something years. Well, let me not say that, because when 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 you're a kid or when you're a child, you know, there are certain things that require for you to get your annuals and your physicals done,
Right.
right? But I'm somewhere in my mid 20s, and I decide, you know what, I'm going to start doing this. I'm going to take this a little bit serious. And when I say take this a little bit serious, that means just show up in the office once a
Mhm.
year, right? That's take it serious. Showing up in
Yeah.
the office once a year.
One time.
Right. So if to be practical, right, uh, we're in a system whereby it's healthcare is not cheap.
Right.
Healthcare costs, right? And
Right.
depending on your insurance, you may be allowed to see this physician, but not that physician. Okay.
Mm.
And I get exactly where you were going, right? But I cannot start or I cannot delve into that uh, without first of all saying when you jump on a plane, you don't decide if if the pilot is black, white, male,
Right.
or female, right? You
Right.
just you jump on the plane and you get to your destination. And
Right.
with respect for the field and the hard work that goes in for
Mhm.
people who achieve this milestone, at no point in time will I say, "Oh man, you should absolutely look for this or look for this kind of doctor."
Right.
But uh, with reality, we also come to understand that when you have a common background, right, things seem to be much easier. Things seem to flow
Yes.
much
Yes.
better than 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 starting off from different origins. Okay,
Right.
things and I'll go back to when I picked mine. Very funny reason. Don't judge me, but hey,
No, no
I'm
judgment
hoping.
here.
I'm hoping on the men's health on the men's health hub. There will
Yeah.
be no judgment. But when I did pick
None.
mine, I
None.
think I think when I went in, I was looking for an Asian lady, right?
Oh wow.
And you can ask me why. You can ask me
Why?
why. This is
Because
this
they
is a
want
good
to
guy.
know. So I'm gonna ask it why.
They want to know. I was looking for an Asian lady because when a man gets to 40, starts
Mhm.
getting just a bit advanced up in age, one of the biggest concerns is prostate cancer, right?
Yes.
And
Yes.
there's something called a DRE, a
Mm.
digital rectal exam,
Mm.
digital, right? So I'd be far-fetched to find me a football player or a basketball player who was a physician, digital.
Right. Right.
Right. So I
Right.
went for I
Okay.
went I went for an Asian female, right?
Okay.
And that is a gaffe, right?
Mm.
However, she was she was extremely competent at what she
Okay.
did. And it also helped. And what also helped was that I had a medicine background, right?
Okay.
Like now when I go see my primary care physician, right? Uh, I'm almost at I'm almost at the position to where I request certain tests to be done, right? I'm blessed to be able to understand what's happening, so I can request certain things. So that
Right.
absolutely wasn't an issue, right? However, what I do see in my everyday practice as I'm practicing now is, you know, depending on whose room I walk into, right? Certain people would just automatically be comfortable telling me certain
Yes.
things, right? We
Right.
cannot, we will never discount the fact that, uh, we'll never discount the fact that you can just feel more comfortable with a certain individual compared to the other.
Right.
And the whole experience between a patient and physician, it's one of the most surreal because you meet
Yeah.
this person, you have no clue who they are, right? And you have to tell your, if you, for the betterment of your health, it's best to tell them, you know,
Everything.
your most intimate details, right?
Right.
This, it's
Right.
up to you because a physician can only treat what he is told, right? If you
Yeah.
don't tell me, then I cannot make a problem out of a problem that I'm
Mm.
not told about. All right.
Right. Right.
So
Right.
coming back to, you know, I know I did this nice big song and dance.
Yeah.
One,
Yeah.
I wanted to make sure that it's not just a let me find a male physician because there are a lot of very capable uh, female physicians who are some maybe even more capable than the men, right?
Okay.
Who deserve all the credit and
Right.
who will be just as phenomenal as your PCP as a male physician, right? Um, However, it is true. There's no hiding it. There are not that many black
Yes.
male physicians out there. That is an epidemic or pandemic, whichever one it
Right.
is, whichever demic you want to call it. But that
Right.
is an epidemic that is
Right.
truly plaguing our society as a whole. And um, do I do? Is it a different air when I walk in and uh, is it a different air when I walk in and it's a fellow brother of mine? Completely different. Even the
Yeah.
language changes, right? The
Right.
same way if I walk in and it's an African sister or African brother of mine, right? The
Right.
language changes in that form and matter, right? And certain things I will understand. I don't have to ask why. You know,
Hmm.
I don't have to ask how. How do we solve the problem?
Yeah.
Um, there's also another thing I would say is there's several things that contribute to us having this problem and being plagued with it. One of the things that may contribute is for whatever reason, and I was talking to a nurse earlier the other day, and she said, "Well, we just don't support our own, right? We I've known, you know, several physicians who've opened up clinics here and there, and maybe their own, I'm not sure if we don't know about it, we
Right.
don't
Right.
publicize it, right? Um,
Yes.
you know, even the way I found my dentist, I fly to Houston to get my dental work done.
Wow.
It's not because I cannot find a competent dentist here, but
Hmm.
you know, this young gentleman I went to school with, right?
Hmm.
And he has mastered his craft. He has opened his own business. So I think making that sacrifice of, you know, $350 here to
Yeah.
book my appointment with him makes a significant difference, right?
That's some
So
good support. Like
yeah,
that's you're being a
so
good friend and you're bringing awareness to others
yeah,
because like you
so
said people may not know.
yeah, people may not know. So it's when you embark on it's when you take on these challenges to
Right.
I'm going to it's almost like being away where your black dollars are or
Mhm.
where your dollars go, right?
Yeah.
You can show the same awareness with your healthcare, you
Mm.
know. So I do know there are tons of physicians out there who are, you know, brothers who are very capable, right? Well skilled. You know,
Right.
I see them all the time. Could there be more? Should there be more?
Yes.
Absolutely. But I think another aspect of it is also word of mouth, you know, having
Yeah.
these conversations. That's
Sharing.
one. And
Yeah.
also, if you get a chance, support them, right?
Yeah, absolutely.
Go to their
Absolutely.
clinic, right? Don't
Absolutely.
don't be scared that, he don't listen, don't be scared that, yes, oh man, he's in my church. I may show
Right,
up with
right.
some
They know
weird
my business.
infection and now
Yeah,
they know my business.
yeah.
To divulge your business, he's putting his license in
Right,
jeopardy, right?
right.
And nobody goes through all of this just to lose all of it because you felt like telling a really
Somebody
funny
else's
dinner
business.
joke,
Right. So
right?
I agree.
Through
I
somebody's
want to
business.
dive into some other parts, right? So
Yeah,
you were in your 20s when you kind of sought out your
that's when
PCP,
it happened for me.
and that's when it happened for you. I know for some people personally that I know, their jobs make them have yearly physicals
Hmm.
just to see, okay, are they competent enough, physically good, things like that. What are some, let's go basic. Someone that's maybe they're in the 40s, never been to a doctor, and maybe they're watching the Health Hub with Dr.T and Dr. Mbah, and they're like, hey, I want to go see a PCP, or I want to go see my doctor. They go on their insurance, they find one.
Yep.
What should they expect when they get there? What should a general physical look like for them?
Okay. A general physical, right? So I believe insurance pays for an annual physical.
Yes.
Almost any standard insurance plan pays for an annual physical. And it's for, on the other end, as a physician, you actually get a decent reimbursement for it. So trust me, your primary care physician will never miss your annual physical. What your annual physical entails of is one, just uh, it's almost as if you set a foundation, right?
Hmm.
And then you come back on a yearly basis and you check your foundation. You want to make sure that, okay, this hasn't changed, this hasn't changed, this hasn't changed. And when I say you set a foundation, because initially it starts with, just an overall history, right? Anytime a patient walks into my examining room, it's, hey, how have you been?
Right.
What brings you here? If this is the first time I'm seeing you, what brings you here? What have I missed? How old are you? You're 20, you're
Right.
30, you're 60,
Right.
right? What kind of life have you lived? Have
Mm-hmm.
you, are we talking about a history of uh, 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 cocaine and drug use, or are we talking about, you have been, an avid runner 4 or 5 days a week? Because all of that will determine uh, what my concerns become moving
Okay.
forward, right? So you have this open history where you want to give a quick summary, right? Because
Okay.
these visits can also last maybe about 15, 20 minutes max, right?
Okay.
And then you go from that basic history to, all right, now let's do a physical, right? Head to toe, you want to check, very simple things, right?
Yeah.
You want to check your eyes, make sure the muscles are working, make sure you have proper visual acuity, right? You can also they can check your cranial nerves. There are various things that go on with that to get that checked. And then you come down, you want to do a cardiovascular check, listen to your heart, make sure there are no adverse rhythms or no murmurs or various different things that are concerned when it comes to heart health, right? And then
Mm-hmm.
after that, you want to listen to the lungs, make sure the lungs are nice and clear, air is moving in and out. You want to listen to the stomach, right? Make sure you have appropriate bowel sounds, right? You want to
Mm-hmm.
palpate the stomach because based on how the stomach is where you're palpating, you can feel certain things. You can feel the liver in that top right corner. You feel the
Right.
spleen in the top left corner, right? And from there, you check the extremities, right?
Right.
Normal range of movement, normal strength in all extremities, right? That's a basic physical exam, right?
Okay.
Some doctors do it, more in depth than
Yeah.
others,
Yeah.
right? But it needs to be something along those lines, right? And
Okay.
then, you go from what you can physically examine to what you need to to now examining the physiology of the body, right? You want to know, okay, how is the heart functioning? How
Right.
is the lungs functioning? How's the liver functioning? How are the kidneys functioning? And they're all blood tests to determine all these things,
So
right?
that's what I was gonna go to is
Yeah.
through the exam, are there any, I guess, red flags for doctors? Obviously, your blood work is very important,
Yeah.
right? Your
No,
blood
the
work shows a lot, but are there any physical signs that during a physical, your doctor may say,
mm,
you may
I
need to
mean,
come back or we need to dig more into this?
yes, they are, right? So I just got out of a cardiology rotation, so
Okay.
I'll give you one right now, right? Swollen legs, right?
Mm.
If you show me somebody that has swollen legs and it's and they're just chronic, always swollen, those are classic signs of cardiac concerns, right?
Mm.
So there are tons of things. You can have. There's another one where you have splinters on your nails, right?
Oh, wow.
That's another classic sign for cardiac issues.
Wow.
There's so much, right? There's so
Wow.
much you can see from that, even from the eyes. I can look at your eyes and tell you if I should be concerned about your liver. If your
Mm.
eyes are yellow, right?
Right,
That's
right,
hyperbilirubinemia, right? So your liver is supposed to break down, the byproducts of
right.
blood cell breakdown. So there's so many things that can be done that will trigger a further evaluation one way or the other, right?
Okay. Oh, wow.
Yeah,
That's good to know because
yeah,
I never even thought about your fingernails. I've heard the eyes, right?
yeah. The
But I've
eyes.
never heard of fingernails, and that just
Yeah,
seems to be like, wow. That's
yeah.
that's
Even
that's im- that's
yeah,
important. Have
even
you
on your
ever had?
skin.
Yeah.
There's so much. There's so much. That's have I
That's
ever
a lot.
had?
We could
Please
be here all
continue.
day. We could be
We
here
be
all
here all
day.
day. We
So
really
for
could.
men, have you heard or experienced any man that maybe the wife had to drag him to his appointments? Or do you feel like most men, excuse me, want to take charge of their health and come in? Or is it that there's a reason bringing them in?
So I think it's it's common knowledge that women seem to adhere more to their health than men. It's
Mhm.
just pure common knowledge. I'm not sure if the machismo of the man or whatever it may be that makes us feel indestructible. But what
Mm.
you end up seeing than more than usual is that people show up when it's maybe too late.
Yeah. Yeah.
I would have loved to see you, a year or two ago when,
Yeah.
maybe your ejection fraction was at 40 instead of
Mm.
10 or 15.
Right.
I would have loved to see you a year or two ago to counsel you against, hey, let's cut back on, this hard alcohol for a little bit.
Right. Right.
The liver is not liking this too much.
Yeah.
I would have loved to see you 4 or 5 years ago, to
Mm-hmm.
tell you, hey, let's cut back on the let's cut back on the sugary foods, right? Your
Yeah.
kidneys are not quite as happy with, what's going on here. So I think that's what I generally see more
Okay.
is it's more reactive presentation, instead of
Then being
proactive
proactive.
presentation,
Right.
right?
They're
It's
reacting
more
and not pro.
reactive than being proactive.
Yeah.
And if anything, I mean, even the Affordable Health Care Act, right?
Yeah.
When that was instituted, it switched the whole healthcare institution from, all right, we're no longer being reactive and charging and billing the insurance thousands of dollars
Yeah.
because they just won't pay. They said, no, we're
Mm-hmm.
capping, we're no longer paying. So what a lot of companies went to, and you touched on a little bit of this, is they will force you to get an annual,
Yes.
right?
Right.
That's one of
Right.
the reasons why they force you. They don't do it
Right.
because it's not done because they care about you and your health, right?
It's
Right? They
yeah.
force you to get an annual because in the long run, you know, helping you manage, stage 2 or stage 3 chronic kidney disease is much cheaper than having
Yes.
you on dialysis,
Right, right,
right?
right.
Um,
Ooh,
yeah,
this is a lot. This is a lot. I think men's health is very, very important. I think men well, they're groomed, I should say, to be our providers. And
yes.
I think that sometimes they get so caught up in that, like you said, maybe some men feel like they're indestructible. Maybe they feel that, it's not that bad. They kind of brush it off until it
Hmm.
gets really bad. But I think another thing is having them being able to mentally be prepared for it. Mental health is part of health,
Oh, that's the big
so
one.
they may feel that, and this is just my speculation, because before I do these lives, I kind of talk to random people and just kind of pick people's brains to see what they think. And someone said to me, if I went to the doctor and I found something or they told me something, in my mind, I feel like I can no longer provide for my family. And so I would rather just, it's clearly not that bad
Tough it
because
out.
everything is okay. And so it took me to the mental health part of it, that the battles that most men think and what they worry about and how they see it is completely different than women. Doesn't mean it's better or worse, but it's just different. And so they're looking at it like, will I not be able to be a man anymore because now I have this? Have you encountered or experienced anyone that, you kind of have to pull in a little bit of mental health into your physical health and your medical health?
That is a daily issue, right? No, that's a
Yes.
daily issue. That is a daily issue. Uh,
Yes.
it, I think most of that comes with, just education, educating yourself, understanding why certain things are required, understanding,
Right.
what, health is, all
Yeah.
around health, understanding that, right? And is also having the wherewithal to have these conversations, right?
Right. Right.
But it's absolutely true, right? A man, men will will withhold themselves from the hospital for
Yeah.
whatever reason, and especially in our culture,
Yeah.
right? Everybody has either seen the Martin or the whichever show or the Jamie Foxx show
Right.
where the theme or the parody for that show is, oh, I ain't never going back to the hospital. Every time I go to the hospital, they tell
Yeah.
me this is wrong, right? But I
Right.
was home, it was just fine. No, it
Right.
wasn't.
Right.
No,
Right.
no, it wasn't, right? And
Yeah.
and and it's not, I don't think this is a zero sum where it needs to be, oh, you must go. You have to want to go, right?
Yeah.
You have to
Yeah.
want to
Yeah.
go, right?
Yeah.
The same way you stand up and you take your car and you get the oil change done three
You have
times
to
a
check
year,
yourself. Yeah.
you have to go get your oil changed. And all you have to do is once. All you have to
Yeah.
do is once. Once a year, establish a baseline so you know how to proceed forward. There's
At what point do you move from physical to mental health? At what point do you have a patient or you've experienced anyone where you're like, okay, I there's more to this than just medical health. There's more to this that's physical. When do you incorporate mental health, or do you incorporate mental health in your, I guess, in your treatment plan for any man that comes in with any problems?
So my answer to that is, if your PCP is not incorporating mental health in the total package for your
Mm,
health care, you need to find a new one, right? You absolutely need to find a new one. Gone are those days that we think talking to a psychiatrist or talking
Yeah.
to a therapist, right? It's so funny now how we've gone from, oh, you're not seeing a psychiatrist, is a therapist, right? It's different. They call it a
Yeah.
therapist, right? But
Yeah. Yeah.
if your primary care physician is not incorporating that, find you a new one, right? It can be whichever,
Mhm.
but find you a new one because it's absolutely important. I don't think there's any other society on this planet where mental health should hold the importance and the value that it's at its highest peak other
Right.
than this country, right?
Right.
I don't think there's any, just the stressful nature, the
Yeah.
various different stressors that you deal with, work,
Yeah.
family,
Yeah.
social life, name it. There's so many. Just having that outlet, even if it's just cracking a joke with with
Yeah.
your PCP, or just sitting there saying, sometimes there are days. So I have a mentor, right? So
Hmm.
I have a mentor who every now and then he will take maybe about a good 45 minutes to an hour on one patient, and there'll be three or four others waiting.
Wow.
But
Wow.
something has happened, and he deems it very, very important and very vital to
Important.
sit and have this time and this and 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 just talk and dissect whatever may be the concern at that point in
Right.
time,
Right.
right?
Right.
So it's extremely important.
And
Uh,
I think once you have a man there, I feel like grab on,
grab
right?
on.
Like they're here. Okay, I'm gonna ask you to do this. I'm gonna ask you to go here. I'm like maximize it, right? Because
Yes,
I don't know when X is gonna come back. So while you're here, I'm gonna say, okay, go get a checkup here. Go get a
go
checkup
get
there.
this here. Go get
You
this
know,
here.
just
Yeah.
to kind of check all the boxes. Okay,
Hmm.
we're gonna pause a little bit and kind of see what people are saying in the chats.
Oh yes.
Um, we do have some chats. Like I said, he is not your personal doctor, disclaimer. So there's so
She's
many
looking for
behind the scenes comorbidities and things going on that, he doesn't have the full picture. So he cannot explain or answer specifics. All right, my husband had a male PCP who would always evaluate his testicles during annual exams, but the female PCPs he has seen have never done it. Should this be standard practice? Oh.
Oh. So what?
Without you getting into
Right.
it.
It's a hot topic.
It is. It is.
Okay. So there is the practice of palpating the testicles. To be honest, it's it's a bit archaic, right? It's just a bit archaic, right?
Right.
But that's not saying that because it has worked for all these years, it's no longer working now. Or let's
Mm,
say if we have some new test, right, that we can check for scrotal abnormalities, right? If we have some blood tests, we can check for scrotal abnormalities. That does
mhm.
not mean that we now neglect what the original test was, right?
Yes.
Because
Yes.
you can tell deformities, you can tell growths on the testicles
Yeah.
prior to checking for cancer markers, right?
Mm,
So what I will say in response to that, because I don't think there's a wrong answer, right? Because
right. Right.
if there is concern for scrotal malignancy or whatever it may be in the scrotal area, tell your physician, can you check this for me?
Yeah. Yeah.
Yeah, tell
So
them.
I let me let
Remember,
me
you're
let me
paying them to work for you. Tell them,
you
say,
are.
check this and check that.
Yes. So let me ask this. So women for breast cancer, we're taught to do like a self evaluation, right? We're
And
taught to
men
do it in
are
the
equally.
shower. Are men also encouraged to do an
Yes,
evaluation? Okay.
yes,
Okay.
yes. That is very true. On a
Okay.
daily basis. On a day, you
Oh.
don't even have to be in the shower, right?
Okay.
You don't have to
So
be
I
in
was
the
gonna
shower.
ask that. Is
You
there
should
a
know what
certain
it looks like. You should know what it looks and feels like,
yes.
so that when you feel something that's abnormal, you're
Mm,
because what people don't understand is you are the first
Yeah.
physician. You do the first exam, right? I
Yeah.
do the secondary exam with just a bit more knowledge of what I'm looking for or what it should look like, right?
Mm.
But when you show up and you're like, Doc, look here, this doesn't look, you've already examined that area. Something
Right.
tells you this is off,
Something is
right?
off.
So it's
Yeah.
absolutely encouraged.
Okay. I'm glad because I only really hear of women. So now it's good to be like, hey man, I don't want to say play with yourself, but you got to feel and just
Yes,
kind of
you have
see
to.
what's off. Okay. Oh,
Nice and
that's a good
smooth.
one.
It shouldn't be bumpy. There can
Okay.
be asymmetry, right? There can be asymmetry between both testicles, but it
Okay.
shouldn't be that significant.
Okay. It's not like our breasts, right? For women, our breasts aren't the same sizes, but it
Simple.
shouldn't be. Okay. Oh, thank you. All right.
And you
MC, okay, she's
are you supposed to say God didn't make man and woman alike? They
similar,
just
but
took
we're still very different.
they
Still
just
very
took our
different.
breast and put it elsewhere and
We're
made them
very
smaller.
different. Okay. Another question is, what should we be looking for when randomly picking doctors? I'll say picking because I think that's what you meant. Picking doctors from an insurance website. There's gotta be a hack. Woo.
There is
Oh.
a hack.
Oh.
What is so every physician has to. So you disclose your what's that? Your provider's information, and
Okay.
each patient that you see can actually leave a review
Right.
with your provider's information. I'm trying to remember this website, but there is a Yelp for doctors, right?
Okay.
Read up on it. Read up on it. You can do that, or you can rely on what we've always relied on. Hey, who do you go see? Are you
Mm.
happy with them?
Word of mouth.
Right? Who do you go
Yeah.
see? Are you happy with them? Uh, if not, then you know, go on the website, pick one, Google them, right? You can all these things. I'm not saying
Hmm.
anything that you cannot do from your phone and in the palm of your
Right.
hand. You can Google them. You can look. You can see where they went to school, where they did their residency, if that's
Mm.
what really matters for you.
Yeah.
But for me, if anything, I like to get feedback from your patients. So what will matter to me is what have people come back to say about you.
You. Yeah.
So if you were to ask me, Raymond, go online, find me a doctor, that's what I'll do. I'll find
Okay.
one, look at what the reviews are. You can look to see how long they've been practicing. But what I will tell you is some people are really good at what they do right off the bat,
Yes.
right?
Yeah.
And some people forget how they used to do it after they've been doing it for so long,
No,
right?
right.
So there is that double-edged sword.
Okay. I mean, that's a good answer because there is no right answer. I think for me, personal input here, when I was shopping for my
Shopping.
OBGYN, that's what I called it, right? When I was interviewing for my OBGYN when I was pregnant, I, got recommendations, but I went and met with the doctor and I'm a
Hmm.
vibes girl. If that
Yep.
vibe is not vibing, you're not seeing me
Nope.
again. Doesn't mean they're not a good physician. Doesn't mean, but I want to be comfortable sharing things with you. So I say interview the doctor and just say, this is what I would want for myself. What are your beliefs? What are my beliefs? And just kind of go from there. So there is no right answers. Yelp reviews.
Yep.
People tend
Reviews.
to want to go back and put positive and not put pause. I mean, excuse me, they want to go back and put
Put
negative and not the
negative.
positives,
And
you know.
sometimes it would pique my interest.
Yeah,
Why do you keep getting only nothing but negative reviews? It'll pique
I
my
know.
interest. Or why do you only have positive reviews?
Positive, I
At least
know.
one, like, also, look for something that feels genuine, right? You
Right,
don't want the
right.
doctor that
Yeah.
everybody is raving about. It's like, hold on,
Right.
are you giving out extra Ozempic, just to
Giving
get
out
people,
some bad.
what
Yeah.
is it? What are we doing here, right? But yeah, that does
Okay.
work. There's several ways.
Next one is it is standard care of sorry, it is standard of care to do an annual depression screening on each patient. Major health systems have systems put in place to make sure it is being done.
Yep.
Awesome. But are they being honest? Are
Is
they
the
being honest?
patient
We
being
have some
honest
doctors in
on
the
her?
chat.
Is the patient being honest, or is the
Yes.
doctor?
No, are the men
Listen,
being honest on that scale or that
what
screening?
what I will tell you is this, right? And I tell every single one of my patients, right? I cannot treat something you don't tell me about. And if
Yeah.
I don't
Yeah.
know about it and I need it's just that simple,
Yeah.
right?
Agreed.
I cannot. So and you're doing this for yourself. You're not doing this for me, right? So
Right. Yeah.
remember that.
For your
Remember that.
health.
This is for you. This is for your
Yeah.
health. This
Yeah.
is
Yeah.
not for me. I get no
No.
pleasure. As a matter of fact, if I could stay at home and still get paid, you would not catch me here.
All of us. All
Okay,
of us.
right? You
So
wouldn't catch
someone,
me here. So I think it's there's no other way but to encourage
right.
and as physicians try to build that connection and just have people being comfortable around you.
Absolutely. I don't think any man knows he needs to be checking his scrotum routinely. Well, women, check it for him. How about that? You check it. If he ain't checking it, you
You
check
check
it.
it.
You know, if it's what it's typically like.
Hold on,
So
wait,
go
Dr.
ahead and
T,
check it. And
Dr.
I'm
T,
sure the men would love that.
Dr. T. Can I equally encourage my brothers to check their wives? Because November's coming along.
Everyone check everyone.
Everybody check
Everyone check
everybody.
everyone.
Everybody
Fellas,
check
check your
everybody.
look. Prince Kato said, fellas, check your daily in the shower. There you go.
There
Or
you
like I
go.
said, have your significant other, your spouse check it. All right.
Yeah,
Best
absolutely.
decision I made last year was to talk to my doctor about change in my number two. Say, oh
Oh,
wow.
yeah, see?
But I love that because you're honest and you're
Hmm.
sharing
And
with them
you,
because you don't literally it could have saved your life. Like when people say, "Oh, it saved my life," literally
it
you
did.
don't know how things can manifest into bigger things. So I'm so glad, and please chime more about that as to what made you comfortable enough to share that with your doctor while I go to the next question. Someone said, should what kind of blood test should be done for a 360 of the health? A physical only covers a few items. I didn't know this until I asked. Well,
Okay. If
what's a 360 of the health?
360,
Okay.
360, so a generalized blood test, right? You want to do
Okay.
electrolytes. You would want to do a comprehensive panel, comprehensive blood panel,
Mhm.
right? What that will check for is one, the electrolytes in your blood. Two, it would also check for your liver function. It would check your liver function tests, AST, ALT, ALP, and then it will also check your creatinine, which is kidney function. And on top of that,
Mm.
you want to add a lipid panel to that, right? The lipid panel will check your HDL, LDL, as well as your total cholesterol. On top of that, you also want a complete blood count with differentials. Well,
Oh,
yeah, complete blood count with
yeah.
differentials because if any one of them is elevated, you want to know which subset is causing the elevation, right? So right there, right, just right there, I've checked your electrolytes, which
Mhm.
can give me a really good picture of can give me a very decent picture of what your cardiac function will look like. Um, I've checked your liver function. I've checked your kidney function. I've
Mm.
also checked your cholesterol, which is gives me a good idea on, do you have, like artery disease, coronary or peripheral.
Okay.
Um, what was the other thing oh, blood count, right?
Yeah.
I've checked that. So I know about your immune
Mm.
system. I know about, your hemoglobin. Are you anemic? Are you not anemic? and then it also will tell you and hint you for further evaluation if, let's say, we're talking about, maybe like blood cancer or something
Right.
else of whatever sort it may be, right? So and that's just right off the bat.
Right.
Now from that, I think that's like the base, of the base. That's the basis that you can start from. And if something comes back concerning, there's so many more others that you can continue to evaluate.
Wow, that's a lot. That is a lot, and I think obviously I'm in the healthcare entity, so it's easier to know this. But if you're not and you're not sure, talk to your PCP about it and just say, I could say I want a comprehensive care. I want all the blood work. Some
Yeah,
people say I just want what my insurance covers. That may be different. Insurances are different. But
never
if
go
you
in there
feel
with
like
that.
yeah. If you feel like there's
Never go in with
more,
that.
ask for more.
Ask for
Okay.
more. Oh, I did.
Yeah.
Before I forget, don't forget the sexually transmitted, infections. There are a lot of single people out here, and you should
Hmm.
at least. I think, um, is it was it U.S. Preventative Task Force? They recommend that you get an HIV screening at least once. Everybody on
Wow.
this planet should get an HIV screening at least once. The the target population is between your 20s and 30s.
Oh, wow. That's
Yeah.
good. That's very good to know. Wow. Thank you for that. All right. Someone said, what are the right questions to ask the PCP to ensure that they are the right fit for you? Oh, that's a good one.
Okay. Um, I think overall, you're able to, the same way you can sit at a bar and somebody sits next to you and you just carry on a very natural conversation, right?
Yes.
I think that should be what your interaction with your PCP should be,
Yeah.
right? You sit at a bar, very random person, you just carry on a very nice, casual conversation, very educational.
Right.
Perfect, right? Now, things do segue into, let's say, you may be into holistic medicine, right?
Mm-hmm.
Then those are things you want to ask your physician. It's like, hey, what are your thoughts on this? What are your thoughts on that? Right? Whatever it is you like doing. If you're into vitamins, right? I had a patient the other day came in, had been taking this vitamin, and he swore it was just helping him more than anything we had ever given him, right?
Uh,
And and a certain my role and my goal in that position is not to, okay, no, stop, but is
right.
more to, all right, well, since you're taking this vitamin, I'm concerned about this chemical and that chemical in it,
Right.
and those could keep you prone to maybe liver
Mm.
or kidney issues. I want to go ahead and just check your liver and your kidney just to make sure
Right.
before you
Okay.
continue. So just things like that, right? The things that you value in your health, those are the
Mm-hmm.
things that you want to ask your physician what his opinions or what her opinions are, to these things. If you don't like taking medication, right? Or, if you're not the person that is going to tough it out with some pain and it's like, no, just load me up,
Right.
let me ride through this, right? So you want to know these things,
Yeah.
or else you pair yourself with the wrong PCP and
You're
it
gonna be
turns into a
frustrated.
headache. You'll be
You're gonna be
frustrated.
frustrated because your goals and their goals don't align.
Do
And
not
I feel
align.
like your PCP should almost be like your best friend. Like you should be able to say, you should be free enough to share with your PCP so that they can make the best decision health wise.
Decisions. Some of the things I hear, Lord Jesus, I don't know if I
I
want to
know.
give some of them back. I'm not gonna lie. I want to give some of those things back. It's like, I see you did not have to.
You did
It's
not have to
okay.
divulge that.
We
But
didn't have to
look,
go
she's
that
getting the
far. I
best
already
care.
understood. Yeah, she's getting the best care because I know just how severe it is now, right? But where we were, it was already severe. I was already planning
Now
on.
we've taken it up another level.
Now it's like, oh, Jesus, do I need to
Let's
refer?
All right, last question that I think we have is, can we talk about sleep apnea in men and how not taking care of it early on can lead to other issues? Sleep is important.
Oh, wow.
Is that
Sleep is
that's like a whole nother live?
extremely important. Listen, sleep is extremely important. It
Yeah.
is recommended that you get somewhere between 6 to 8 hours of sleep,
Yes.
uninterrupted,
Yes. REM sleep.
uninterrupted REM
Yes.
sleep every
Yes.
24 hours. Okay?
Oof.
It is absolutely recommended.
Yeah.
And this topic, I think sleep apnea, there are certain topics that kind of go hidden. I don't think they get they don't get the pedestal that, the sexier, you know, debilitating, the cancers get, right?
Right. Right.
Because,
Right.
when you get, I call them the sexier diseases because those are the ones that, they're making the commercials about.
Yeah.
Those are the
Right.
ones they're doing this. They're not making commercials about the things that kill you
Yeah.
on a daily basis, right? The
Mm.
cascade for sleep apnea is this. One, right? Uh, it could be central or it could be just related to the way your airway is structured, right? Airway obstruction, right?
Right.
If it is related to airway obstruction, that is a simple and quick, easy fix. That is a CPAP, right? Now, if let's say you have sleep apnea, what happens is that you're not sleeping appropriately at night. You're more tired during the day, okay? And because you're more tired during the day, you live a more lazy, lackadaisical
Mm.
life, right?
Mm.
And because you're doing that, you're not
Mm.
expending the energy that you're putting on. So it starts with weight gain. You go
Right.
from weight
Mm.
gain to hypertension, right?
Right.
And then you go from and the worse the sleep apnea gets, the worse the weight gain, right?
Yes.
Yeah,
Mm.
right. You find yourself dozing off in the middle of the day. You're catching these 15, 16-minute naps, right? You're not sure why. You cannot drive long distance. You're
Yeah.
always sleepy. And this is something that if it is airway, um, and the cause is the airway, this is something that is easily taken care of with one,
Mhm.
weight loss, right?
Mm.
Weight loss, right? If you want to do it the hard way, you can do weight loss without. But I recommend any man, if you snore,
Mm.
please, if you snore, please go and get a sleep study done,
Wow.
right? Your insurance will pay for it, right?
Yes.
And your
Yes.
insurance will even give you a CPAP. But
Mm.
if you snore, if your husband snores, tell him to go get
A
a
sleep.
sleep
Wow.
study done, right? And don't be afraid of the CPAP. I'm not sure
Yeah.
why people, there's this big stigma around CPAPs, right? Because people just feel, and a lot of it comes from the older population. I'm gonna put my dad's business out there.
Yes.
I remember when he decided to get one, and mom didn't. Mom wasn't too cool
She
about
wasn't
it,
happy with it.
right?
She didn't like it.
Mom wasn't too cool. Mom was like, "What is that? What if it
Right.
suffocates
Right.
him at night?
Right.
What am I supposed to do?" Right?
Right.
But lucky enough, they had a son who had his background in respiratory therapy. I had initiated so many patients
Nice.
on CPAP,
Nice.
so I was able to talk her down off that. So
So I
first
think
and foremost,
that's
yeah,
a life
go
on
get
its
that
own.
sleep test.
That's
Go
a
get
that's
that
a
sleep study.
Yeah, that's a life on its own. And I know someone personally that used to snore like really, really. As soon as he fell asleep, he was just like gone. And
Hmm.
when he started to lose weight, you could see that he was more energetic. He was sleeping better. His wife wasn't complaining as much. There was just so many
It's a
different, yeah,
life
pluses
changer.
to it.
It's a life
Absolutely.
changer.
But I think that's a topic on its own because how many of our husbands and some wives snore, and how many
Snore.
of them later on we see that there's hypertension, there's so
There's
many
hypertension,
other
everything is connected to it. You get
everything is
you get
connected.
headaches.
Yes.
You get headaches
Yes.
during the day because you're not sleeping at night, you're not breathing
Wow.
appropriately, so your CO2 is elevated in the blood,
Wow.
right? Hypertension, you gain weight that puts you're predisposed for diabetes. There's so much that
So
comes
much. Oh my
just
gosh.
from
So much.
sleep apnea.
Yeah,
Just
I
from
think
sleep
it's gonna
apnea.
be alive on its own. It has to be alive
Yeah,
on its own because
it has.
there's out of this is my stats. This is not Google. This is my stats. 1 out of 2 men and women snore. So
Snow.
we need to have this live. But we
Yeah.
are running out of time. I don't think one live is enough about men's health, about any